Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. For those tuning in tonight for the first time, One Healthy Boston is a community resource brought to you by a partnership with WCVB and South Shore Health. And you can learn more about it by visiting onehealthyboston.com. There's a wealth of information there about how you can achieve overall good health and well-being. We are talking about the benefits of home care tonight, whether it be taking care of an elderly patient in the comforts of their home or someone who's had surgery and needs a little extra care outside of the hospital. Home care brings you high quality health care in the comforts of your own home. And today we are joined by Lisa Royer, who is the Director of Home and Health Resources at South Shore Health. Lisa, thank you so much for joining us tonight.
Thank you for having me.
We are thrilled to have you. We want to invite our viewers at home to send in any questions about related to home care, anything you may want to ask. Lisa's going to do her best to answer those questions tonight. So Lisa, let's get right to it. Let's just talk about what exactly is home care.
So really, home care can be a lot of different things. This is, wealth of opportunities to receive care, again, in the comfort of your own home. So perhaps, it's a brand new baby coming home that just needs a little bit of extra attention, all the way to end-of-life care, and everything that could potentially be in between, from maybe just some additional social supports or additional help with just those daily tasks. As somebody is aging and we're trying to keep them in the comfort of their own home, we can put some of those supports into place. Or maybe it's somebody who's just recently had surgery, maybe just a joint replacement, or a brand new knee or something like that. They need some therapy, they need some nursing to come in and help them with their recovery. We can do that. And again, back to the comfort of your own home, your own community. There's just nothing like sleeping in your own bed.
There's something to be said about that,
Yeah.
That's for sure. Are there different home care types of programs, or does it sort of all fall under the same umbrella of home care?
There are definitely different programs.
Okay.
And, finding the right program for you is something that, we would help do. So we start off with our South Shore VNA, which is our Medicare certified home care. Mm-hmm. So this is for somebody who, it's a short-term need. It's going to be, they have something skilled going on. They need nursing, they need therapy, or something like that. Recovering from a recent hospitalization, or maybe a stay in a rehab facility, and then you're coming home and you need some of those additional care supports while you continue your path to healing. We usually expect to see people on with a skilled VNA type of service for about 60 days or less. Again, short-term care needs. Mm-hmm. Then you kind of cross into the private pay arena. So this is a very diverse arena of care, and this is for things that are not going to be covered by your insurance. So your insurance, and I think Janet just sent us a great question right about this.
Right.
So I'm going to back up for a second to say, VNA-based care is Medicare certified. That's an insurance-covered care. That's going to be directed by a physician, and that would come, through an insurance benefit. The private pay arena, again, is for all those things that might not be covered by an insurance benefit. Your average Medicare or Medicaid type of product, or maybe your private insurance that you get through an employer. And this could be anything. It could be, maybe a new mom who just needs a little extra assistance. Mm-hmm. She might just need a little help. We're happy to come in and, on a private pay basis and do something like that. Or, again, maybe you're watching your mom and she's just starting to struggle with some of those daily tasks, and maybe we can put a little bit of some of those supports into place, mm-hmm. help her function a little bit better and a little bit more safely, and then extend her time in the home.
So go ahead.
Oh, sure. The last arena is hospice level of care, and that's end-of-life care. So it's very specialized program that really looks at, taking care of somebody through their end-of-life phase, and supporting that patient and that family. They're looking at pain management, symptom management, and really helping a family through that journey.
Okay, so how does somebody determine, that they need home care? Do they make a phone call and say, I'm going to be having surgery next week. I think I might need some help at home. How does that process work?
So, certainly the start place is generally going to be your physician.
Okay.
Having a relationship with your physician, that's a partnership of care. So they are a great place to turn if you think you have a need and you're not sure what it is, or they may identify that you have a need and put out a recommendation or make a referral on your behalf. You can also go to our website and go into the link for home care and ask a question. We'll be happy to get back to you and help you through the process of deciding, do I need care? Do I not? How do I get there? It can be a little bit complicated for somebody who maybe doesn't do this every day. Everybody has their own arenas that they work in, and we're happy to help through that.
Okay, because yes, it can be complicated and all the paperwork that may be involved. Do you help with those types of things and walk them through that process?
Absolutely,
Okay.
absolutely. We're there to help support you through the journey of making sure you have the care that you need or that your loved one has the care that they need.
Okay, we have a question from Roxanne about what about supplemental insurance?
Yeah, so supplemental insurance, and if I'm understanding you right, Roxanne, I'm going to think that you're asking more so about like a long-term care insurance or some of those payers that sit on the backside above and beyond just your general health insurance. A lot of those programs have benefits for that private pay kind of chronic care management that you would see happening in the private pay arena, and we absolutely accept those payers. So we would help you work with your insurance company to find out what your benefit is and how to access it best.
Okay. If someone is looking into care for an elder, how should they even start? What do they do?
I would suggest definitely a conversation with your elder first and foremost. This is, again, it's going to be a partnership. You can reach out to your physician for direction. You can certainly reach out to us or to your local elder services provider. So there are elder service providers scattered throughout the community. There's 26 throughout the state. Then every town has assigned to a different provider, and they can help decide as well, whether it's South Shore Elder Services or a program like that, to help decide as well if you're looking for care, what's the best direction to go. But again, if you log on to our website, we're happy to help you navigate through accessing care.
Yeah, but can it also be very difficult to have those conversations with an elderly loved one who may be a little bit resistant to taking home care at home?
It absolutely can. And being a fiercely independent person myself, I have the utmost respect for somebody that, is really holding on to their independence in their own home. We're working right now with a generation that's aging that is just absolutely remarkable. These folks have done amazing things throughout their whole lives. They're resilient, and independence is definitely a very strong trait there. So accepting help can be a little bit tricky. And how you broach that conversation, you want to start, start small and start early.
Right.
And let that care begin to grow organically. If you have, somebody that you're, mom or dad or somebody that you care about, that you see kind of going down that path that they need some help, you want to start early and start small. Let the care grow. Let them get used to the idea of accepting some help. I always find really great to talk to people about how they've earned this.
Yes.
It's their turn to let somebody help take care of them.
Well, that's a great way of spinning it. I love that. We have a question from Franny, and Franny wants to know, is this covered by Medicare? I think you touched upon that a little earlier, but maybe just a recap again.
So that VNA-based care, that's going to be physician-directed, that is covered by an insurance benefit on that short-term basis. So, maybe, somebody's recovering from the flu, they have some symptoms still, they need some additional care for, the next couple of weeks or so. That would be a Medicare-covered type of care. So we just need to get that referral from a physician, and we can help facilitate that happening. And hospice care is also. For somebody who has a diagnosis of a terminal illness with expected life expectancy of about 6 months or less, that would again be generally covered by a Medicare benefit.
So I know there's so many different scenarios that home care can be available to certain different situations, I should say. But, walk me through what a typical visit for someone who, let's say, again, has had surgery and just needs some extra help at home. What's that like? Are they helping with meds? Are they helping with all of the exercises or visits? I'm not really sure.
Sure. So, everybody's care needs are going to be different. So we would do a full assessment to find out what we think those care needs are, and then coordinate with the physician. And they're going to direct the care and say, you know what, I really want you to help them with their pain management, making sure they know what meds they're taking, this home exercise program to help strengthen that knee or whatever it might be, and take a look at that incision, make sure that it's going to stay free of infection and heal beautifully, and stay on that course to healing. So that's going to be very individualized to each patient.
Okay. All right. Sherry has a question about what about a disabled person who needs help with homemaking?
So homemaking falls into that, I'm going to use lingo for a second and call it the non-certified arena, which is usually where the kind of private pay companies live. That's something that you can certainly reach out. There are some payers that do cover that. Medicaid for somebody who's might have a benefit for that. Your insurance is very specific to you. We would do a check to find out what it's going to be covered. But absolutely, there are companies that do that. We do that. We actually do a lot of homemaking.
Yeah, well, I'm sure that it's probably a relief for some
It
families at
absolutely
home
is.
to know that their mom and dad are being taken care of as well, or at least being guided in the right direction.
Yep.
Can you remove and add services as needed? Is that how if you had a ton of services, and then can you remove them as you go, or can you add them as you go?
So on that VNA type of care, we expect that we're going to probably start with a lot going on, because that's when you're the sickest and you have the biggest needs. That care should diminish as you get better and better, and you get stronger and stronger on your path to healing. You're going to see those care needs start to diminish. You might see different services discharge, but maybe nursing needs to stay in, but we don't need physical therapy anymore. So they might come out of the case, but nursing would stay in until they needed to come out. That's generally on that VNA type of physician-directed care. On the private pay side, we usually see it go the other direction, where we start smaller and it tends to get bigger and bigger as as somebody kind of progresses down a chronic disease path.
Okay. And when you develop a plan with their doctor and with VNA, is it written out and sort of spelled out so everybody is on the same page and they know what's going on and everyone's communicating together?
Absolutely. All of our care plans are developed in coordination with our patient, with their primary caregiver. This is a joint venture for all of us. We all need to be on the same page as we're going through a care plan and on that healing path. So we're going to develop that care plan in partnership with the patient, review it with the doctor, make sure they agree, and then go from there.
Okay. And is care given 24 hours a day, 7 days a week, or are there certain times that...
So private pay care is absolutely available 24/7, 365.
Okay.
For somebody that maybe is on VNA, maybe they're getting infusions at home, right? And IV antibiotics at home in their home environment. If that dose is due in the middle of the night, we absolutely have nurses working 24/7, 365.
And what about emergencies? Here we are, we live in New England, and, we could have a major snowstorm or something going on, or power goes out someplace. How are there protocols put in place so that you still are going to get your care at home?
Absolutely. We absolutely take a look at all of our patients that are queuing up. We pre-plan for every snowstorm. We rely on our partners here at the news station to keep us on track there. And then we're looking at that weather and pre-planning, making sure that all of our patients have what they need. We're calling patients, especially, all of our folks out on the coast, if we think there might be some flooding or things like that, and really triaging and planning with our patients in advance. But we have had nurses snowshoe to patients.
I love that.
In the really, significant weather.
Yeah.
We had patients that they needed us, and we were getting there, and we had a nurse out with her snowshoes. A lot of our nurses carry shovels. And we're digging our way into the house if that's what we need to do. That's home care. It's what we signed up for.
Yeah, absolutely. I just want to remind our viewers at home that we are talking about the benefits of home health care. I'm joined with Lisa Royer, who is the Director of Home and Health Resources at South Shore Health. We want to just welcome you to send in your questions, anything about home care. Lisa's going to do her best to answer those questions. Lisa, getting back to, we had a nurse snowshoe in the middle of a storm to get to her patient. I know that they're there to help them with their physical recoveries and their health, but talk a little bit about how some of these caregivers help with the emotional side too. I mean, how nice is that to see someone come into your home and take care of you?
so many times throughout the day, we are finding we are the only person that patient might see for the day, for a couple of days. They're really, especially as somebody is aging, isolation is a concern.
Yeah.
The more isolated we are from our community and from being part of that fabric of the community that we helped to build and be a part of for so long is really very difficult for folks. So we like to bring that outside right back in and provide some of those connections. Sometimes it's just a chatter, while we're providing care of just different things that are going on and the weather and, different whatever it might be that patient has interest in, to make sure that they're feeling that connection. And then, to the very best of our ability, as we're helping them regain strength and mobility, it is to make sure that they can go back to living the life that they're used to living and being a part of that type of a community program.
Sure, that's so important. We have a question from Sean, and he wants to know, what are the qualifications for the programs?
So they can be different depending on which program we're looking at, Sean. So for our VNA, we are, absolutely talking about, there's a skilled need there. There's something that's going on for that patient that requires, a skilled licensed clinician to be intervening to help them heal. So that referral always needs to be in partnership with a physician. That's always physician-directed care. But it could be, anything from somebody who's maybe just, maybe they have a new diagnosis of diabetes. Having a clinician come out to my house when my daughter was diagnosed was everything. And my husband and I are both healthcare professionals. But we needed somebody else to come out and help us through that new diagnosis until we were comfortable managing on our own. Or, for somebody who is looking at the private pay arena, there really are no qualifications. It's just that somebody's identifying that either there's a need or there's a desire to have some help, and we can jump in and help.
Okay. Karen and Lisa and others would like to know, how do patients find home care and how do they even start? So let's go back to that again. How do you even start with this?
It can probably seem a little daunting. Yes. It can be a little overwhelming if you're trying to figure out, where do I begin? Again, a great place to start is a conversation with your doctor. That primary care physician especially, they are your partners in your healthcare journey, and they're with you for the long haul. So they're a great resource to turn to. Community centers, senior centers are a great resource to turn to. And our website, I think, has actually done a really good job trying to just be accessible so that you only have to go to one place and put in a call, and our receptionist is going to help decide where you need to go and get you on the phone with a subject matter expert, myself or one of my colleagues, who's going to help you just start walking through the journey of accessing care.
Okay. Is there any effort made at all to match a particular patient with a particular caregiver? Because hey, their personalities are really going to jive. This is going to work.
Absolutely, especially when we're working with private pay type of care. That's that we tend to be there for the long haul. We're looking for a long-term relationship with our patient, and it's really important that our patient and our caregiver get along. Right back to that social connection and having a relationship to build and good interactions and positive interactions. So we ask a lot of questions and try very hard to get it right on the first time. And if we don't, we check, adjust, and we try again.
Okay. What about evenings and other odd times? That's a question that's just come through.
It is. So we're a 24/7, 365 organization. Healthcare happens when it happens, and nobody gets to direct that. Right. So when your care needs are happening, we're happy to be there to help support them.
Okay. You've talked a little bit with some stories about, scenarios where caregivers have come in to help children. And I think from my perspective too, or my experience has been that home care is usually either for people who are either on hospice or adults who, again, have had surgery. But you do have services in place to help parents with children who have some medical needs as well.
Absolutely.
Particularly some of those who may have some cancer issues. Yep. And then the new mom at home who's had a baby. Can you talk a little bit about how those services help pediatrics as well?
Absolutely. So children, it's heartbreaking when you think about it, but children get sick too, and they need us as well. So whatever those care needs might be. It might just be a little bit of reinforcement. Maybe mom went home from the hospital with her baby, a day earlier than, and just needs that, we call it an early maternal discharge. So just a little bit of check-in a couple days later, just to make sure everything's on track. And if there's any questions that came up, we're there to help with those. But we absolutely have, some very long-term chronically ill children on service as well. We do a lot of work with the Jimmy Fund, really supporting those. We have certified pediatric nurses, certified pediatric oncology nurses, highly, highly specialized care with nurses who have dedicated their careers to supporting these kids.
And what a relief that has to be for parents. And you
Absolutely.
even said yourself that help in the guidance you got just for the diabetic daughter, that's helpful. Yep. Lee has a question. Can simple moms with full-time work get help this way? Single moms, I'm so sorry. Can single moms with full-time work get the same type of help or get help this way?
Lee, I think you are asking kind of like from a child care perspective. And certainly that is an option. And trying to decide, is this the right route for you or not? That's just a conversation to have to find out, what we're looking at doing, and absolutely we can explore that.
Okay. What about licenses and do most home care programs have licensed or are licensed by the state? I just want to ask about the certifications and that type.
Sure. So the VNA-based services and hospice-based services are all highly regulated. Healthcare is a highly regulated industry, which is a great thing when you think about it. It's pretty serious. We want people to be really well taken care of. So those are absolutely regulated industries with regular surveys from the Department of Public Health. You expect them to come every couple of years and just take a look and make sure that everybody's doing what they're supposed to be doing and that they're on track. Then some organizations pursue additional certifications, like from Joint Commission or a program like that, as we do, to make sure that we are performing care at the highest standards.
Okay.
The private pay industry in the state of Mass is actually a non-regulated industry.
Oh, okay.
So things you want to think about as you're looking at working with a private pay organization is who do they work with? Are they working with any government contracted agencies like an Elder Services? Are they providing care that way? If they are also, providing those types of services, then that they've gone through a vetting process of their hiring standards and their ethical business practices. You also want to look at, do they pursue a voluntary accreditation with the Home Care Alliance? It is totally voluntary. But again, you're going to know if you are working with an agency that has been through an accreditation process with the Home Care Alliance, they have good hiring practices. They have good standards. Their business practices are ethical and above board, and they have the appropriate policies and procedures in place to well support you and your patient.
Okay, I was going to touch upon some of that myself. How do most home care programs train or monitor their caregivers? And do you have continuing medical education for them?
Yep. So we do have, certainly any of your licensed clinicians, RNs, LPNs, physical therapists, occupational therapists, speech therapists, these are all licensed professionals. So they are doing their continuous education, they're maintaining their clinical license, just like a nurse in the hospital does. Exact same arena. Home health aides, we hire certified home health aides, which means they've gone through an extensive training process, and then we retrain them when they get to us and make sure that the care that they're delivering is up to our standards. And then we supervise very regularly to make sure that everything is happening the way we expect it to.
Excellent. Karen wants to know what VNA does 24/7. What VNA does 24/7 visits, and how do we find them?
So they don't provide care like 24 hours a day, 7 days a week, continuously. They're not moving in. If you're looking for that would definitely be a private pay type of organization that you would be looking at that is going to be able to provide round-the-clock care. But organizations that have evening hours and night hours and can fill a visit in the middle of the night when that's what's needed, absolutely, we do that. If, in terms of other agencies, you would want to contact them directly to find out what their operating hours are.
Okay. So I just want to remind everyone, we are One Healthy Boston Facebook Live. We are talking about the benefits of home care this evening with Lisa Royer, who is the Director of Home and Health Resources at South Shore Health. Lisa, let's just get to a quick question about fees and billing, like how do most home care programs handle expenses and billing?
So certainly we're going to be working with the insurance provider if it's that type of physician-directed care. So we would reach out to the insurance company, find out what the benefit coverage is, and then work directly with them. If there's a copay, we're going to let you know right up front that there might be a copay attached to your insurance or something like that, and then we work through that process as we go.
Okay, and again, how important is it for those at home receiving this care to have that good quality relationship with their caregiver?
That's everything. It really is. Especially for somebody who isn't seeing a lot of different people throughout the day or throughout the week, who is especially somebody who's isolated. Every person that they come into interactions with is crucial to, we cannot neglect the thought about how our mental health affects our overall health. It is all one big picture, one whole body that we need to be cognizant of. So making sure that we have good interactions, great people to provide that care with, and folks that can connect, that's everything.
And how quickly do services start? I mean, if they decide they want to do it, is it pretty quick?
It's pretty quick. It really depends on a little bit about what the ask is and what we're looking to do, and then finding that right match. But our goal is to turn around basically immediately.
Okay. And if there are any problems or issues, how are those resolved? If they have some concerns, is it a phone call to the VNA again?
Yep. It's just a quick phone call, and just you can ask for somebody in the leadership team. We're always happy to hear. If something hasn't gone just right or hasn't met your expectations, we want to know about that so that we can help resolve that. Sometimes it might just be as simple as a miscommunication. But should there ever be a problem, we want to be right on the forefront of addressing any concerns.
I've talked with a few folks over the years who've had hospice care, and they have talked about how caregivers have come in and become a member of their family, and how the paperwork that was in front of them was just so daunting, but they were able to take that from them and say, we've got this, don't worry about it. Spend that quality time with your loved one. How important is that for a sense of relief to be able to sit back and spend those last days or months with that person?
Right. Especially when you're talking about hospice care and that end of life journey, we want to focus all of that family, and we mean family in whatever way, shape, or form they come. That could be, a spouse or a daughter, but it could be that lifelong best friend who's going on this journey with a patient. We want to make sure that they are able to focus all of their time, efforts, and energy on quality and having the best interactions that they can have. So we're there to support in a lot of different ways, be that nursing and spiritual support, or homemaker, volunteers, or specially trained home health aides that can support with that. Our social workers, it's a really diverse team that's there to just wrap their arms around the patient and support those care needs, whatever they might look like, and help if there are additional needs that are outside of that. Maybe there's a need for additional private pay, to help make those outreaches and just pull the pieces together to lift some of that burden.
And I've also had the opportunity to talk to some of these caregivers, and they talk about how they feel so blessed to be in the home taking care of these patients as well. Can you talk about that?
Especially with hospice care, it is a calling. I am continuously impressed and just awed by the work that is done there, as they're supporting different families and along their journey, and it's a privilege. It's a privilege to serve.
That's what they say. What they say, and I think they're angels on earth for sure.
Absolutely.
We have a question from Chris. He wants to know, is home care only for the elderly? Let's talk a little bit about that again.
Absolutely not, Chris. That we are taking care of the youngest of babies all the way through this continuum in all stages of life, up to our folks that are just a little over 100 years old and making us proud. But at every stage of life, there could potentially be a need for home care, and we have folks that are trained to support anyone wherever they may be.
One last question for you. Is it important to identify a primary family caregiver when they're going to VNA services? Is there someone that should be the point person for this? Any advice?
Absolutely. And certainly if the patient's able to be their own person, speak for themselves, has all their faculties about them, then they're our primary person. But if they have that point person in their family that's helping them the most, their biggest support person in their family, then they're just part of the team. And this is absolutely a team. But especially once somebody maybe has had some mental declines, that they're just they're not able to make their own decisions anymore, and that's a determination by a physician, that like a proxy or something is invoked, then absolutely we want to have a direct person and make sure that we have that nice open line of communication.
Okay. If you can think of a few key takeaways this evening for our viewers at home of what they should remember in looking into home health care, what would those be?
I would say reach out. Especially if you think you have a problem on the earlier side of things. Early intervention generally means that instead of having a mountain, you have a molehill. And we can try to manage those care needs pretty effectively and efficiently before there's a big, challenge. We want to make sure that, folks want to be home. They want to stay in their home environment, and our hope is to keep them there. So, as we're looking at somebody who maybe is starting to have what might look like an infection, we want to connect with the doctor and get involved early before there's a hospitalization or before things get bigger. So reach out, ask questions, and join in the team.
Lisa, I think this was a great conversation tonight. It certainly was very helpful for me in learning all about this. We want to thank our viewers for joining us this evening, and we want to thank WCVB for being our host, as well as South Shore Health. You can learn more all about this on onehealthyboston.com, and you can see this Facebook Live event if you've missed it on WCVB TV. We want to thank you so much for joining us tonight, and we'll catch you next month for our next episode or live Facebook.